Okay, the postpartum period begins immediately after delivery and continues for 6 weeks after delivery. Postpartum complication is a complication that occurs within the 6-week period. Chapter 11 codes may be used to describe a pregnancy-related complication that occurs after the 6-week period should the provider document that condition is pregnancy-related. And peripartum is defined as the last month of pregnancy up to 5 months. So ectopic and molar pregnancy is classified to category 630 to 633, and the complications of a molar or ectopic pregnancy, 639 is used for all those complications following abortion, and this is not to be assigned with 634 to 638 category. So pregnancy with abortive outcome. You have abortion, and here's our classifications. Is it spontaneous? Is it legally induced? Is it illegally induced? Or was it a failed abortion? If an expelled fetus weighs more than 500 grams, or if the period of gestation is more than 22 weeks, but less than 37 weeks, the coder would code a delivery code of an early onset of delivery, so 644.21. Now, the period for missed abortion was defined as fetal death before 22 weeks gestation with retention of fetus in ICD-9. And in ICD-10, the period for missed abortion has been reduced to 20 weeks instead of the 22 weeks like we see in I-9 today. So pregnancy with abortive outcome. The 5th digit assignment is based on the status of the patient at the beginning of the encounter. And of course, it's based on the physician documentation. So 5th digit required, unspecified, incomplete, all products of conception have not expelled from the uterus, or completed abortion. All products of conception have expelled from the uterus. Retained products of conception following a spontaneous or legally induced abortion. The coder would choose a 5th digit to indicate incomplete stage, or the 5th digit of 1 is even used when the patient was discharged previously with a discharge diagnosis of complete abortion. So fetal complications that are documented, the coder is going to have 2 codes, one for abortion and a second code for that fetal complication. And in ICD-10, the code for sequela of complication of pregnancy, childbirth is 094 in ICD-10. So not a huge difference there, besides the code looks different. It's different, of course. So here's just kind of a fun little diagram. Complications related to pregnancy. So when an abortion results in a live fetus. So an attempted termination of a pregnancy results in a live fetus. The coder is going to choose code that early onset of delivery, the 644.21, and the outcome of delivery, the V27.0. Let's see. And I think that is the last slide of our pregnancy section.